Cefoxitin is a type of antibiotic that is used to treat many different kinds of bacterial infections. It can also be used before and during certain surgeries to help prevent infections. This medication is in a class called cephalosporin antibiotics, and it works by stopping the growth of bacteria. It is important to take cefoxitin exactly as prescribed by your doctor. The dosage and length of treatment will depend on your medical condition and response to the medication. It is typically given as an injection into a muscle or vein by a healthcare professional. Cefoxitin should be used regularly to get the most benefit from it. To help you remember, use it at the same times each day. It is important to continue using this medication until the full prescribed amount is finished, even if symptoms disappear after a few days. Stopping the medication too early may allow bacteria to continue to grow, which may result in a relapse of the infection. When using Cefoxitin Vial, it is important to follow the instructions given by your doctor. The dosage will be determined based on your medical condition and how you respond to the treatment. If you are administering this medication to yourself at home, it is crucial to learn the proper preparation and usage techniques from your healthcare professional. Before using the medication, be sure to visually inspect the product for any particles or discoloration. If you notice either of these, do not use the liquid. It is also important to learn how to safely store and discard medical supplies. For the best results, it is recommended to use this antibiotic at regular intervals throughout the day. It can be helpful to take the medication at the same time every day to help you remember. It is important to continue using this medication for the full prescribed treatment period, even if your symptoms improve after a few days. Stopping the medication too early may cause the infection to return. If your condition persists or worsens, be sure to inform your doctor. Some common side effects of Cefoxitin Vial may include swelling, redness, pain, or soreness at the injection site, as well as loss of appetite, nausea, vomiting, diarrhea, or headache. However, many people using this medication do not experience serious side effects. It's important to tell your doctor if you experience any serious side effects, such as dark urine, easy bruising or bleeding, fast or irregular heartbeat, seizures, unusual weakness, yellowing of the eyes or skin, or mental/mood changes like confusion. In rare cases, this medication may cause a severe intestinal condition due to a bacteria called C. difficile. If you experience diarrhea that doesn't stop, along with abdominal or stomach pain/cramping, or blood/mucus in your stool, contact your doctor right away. Prolonged or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or any other new symptoms. In the rare event of a serious allergic reaction to this drug, seek medical help immediately if you notice symptoms such as rash, itching or swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. Please note that this is not a complete list of possible side effects, so be sure to contact your doctor or pharmacist if you notice any other effects not listed here. Before using Cefoxitin, make sure to inform your doctor or pharmacist about any allergies you may have to cephalosporins, penicillins, or any other substances. It's also important to discuss your medical history, especially if you have kidney disease, liver disease, or stomach/intestinal diseases such as colitis. Additionally, Cefoxitin may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using Cefoxitin before getting any immunizations/vaccinations. Before undergoing any surgical procedures, inform your doctor or dentist about all the medications and products you are using. If you are pregnant, it's crucial to discuss the use of Cefoxitin with your doctor. This medication can also pass into breast milk, so consult your doctor before breastfeeding while using Cefoxitin. It is important to be aware that Cefoxitin Vial may interact with other medications, which may affect how well your medications work or increase the risk of serious side effects. It is important to keep a list of all the products you use and share it with your doctor and pharmacist. Also, do not start, stop, or change the dosage of any medicines without your doctor's approval. Additionally, this medication may interfere with certain lab tests, which could potentially cause false test results. It is important to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much Cefoxitin Vial and is experiencing serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. You can call 911 for emergency assistance or contact your local poison control center. In the U.S., you can reach the Poison Control Center at 1-800-222-1222, while in Canada, residents can call a provincial poison control center. Symptoms of an overdose may include difficulty breathing and seizures. It's important to remember that Cefoxitin Vial is prescribed specifically for your current condition, so it should not be shared with others or used later for another infection unless your doctor instructs you to do so. During your treatment with this medication, your doctor may also request lab or medical tests, such as a complete blood count or kidney function tests. It's crucial to attend all scheduled medical and lab appointments and consult your doctor for more details on how to manage these tests. Remember to take each dose of Cefoxitin Vial as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. Be sure to follow the storage instructions provided with the product and consult your pharmacist for any specific details. It's important to keep all medications out of reach of children and pets. Avoid flushing medications down the toilet or pouring them into a drain unless instructed to do so. When the medication is expired or no longer needed, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.